We used to think back in the days that it's a woman's issue. Now we are seeing the reality where it comes from. I think men carry the biggest percentage, according to research, somehow. Since we're talking about men, there's another inquiry here.
Yes.
Let's talk about masturbation. Does that cause also infertility? Because you find that most men who masturbate, with time, they become, I think, unable to do what is needed of them.
Yeah.
Does masturbation cause infertility in the long run?
Yes, that is, you see, we used to ignore it. I can tell you in my practice now, I see a number of men who come in with that problem. Yes, they have, the commonest presentation is erectile dysfunction. So they are not able to perform normal sexual function with their wife.
Doctor, to a layman watching us there,
yes.
Let's talk about erectile dysfunction. What is it exactly?
Oh yes, sorry. Yes, so now, how the man's body works is the man's system is supposed to produce sperms in the testicles, right down here. And then, when the sperms are mature and at the time of intercourse, the sperms are passed with the force and pumped through this channel. And then right down here, it's supposed to pass through a penis which is erect and is able to end up properly into the woman's vaginal canal properly, so that it is delivered in the right place. Now, for the people who do masturbation, you know, now for this erection to be maintained, the erection comes as a result of blood going into these muscles in the penis, and that blood is pumped under the influence of the nerves from the brain. So it needs some stimulation, and then that stimulation is able to stimulate, to cause blood to be pumped into here, so that this is turgid and is able to erect well. Yes. Now, what happens in the people who do masturbation is that they use their hands to stimulate the penis. They rub on the penis, and that rubbing is hard, and it gets harder. And for them to always get stimulation, the rubbing has to be harder, and they get to learn how to do it. And you cannot achieve that in normal intercourse. Yes. So their body gets used to the process, to the force, the process, and so the circuit is complete within them and cannot allow the normal interaction to cause this. So they lose the ability to gain an erection and sustain an erection in a normal heterosexual, interaction with a woman. So they always get problems with erection. They get problems with erection, and some of them, they lose it so completely that even the sight of a woman switches it off. Yes, so they get very severe psychological problems which makes them to lose erection. Yeah, so that definitely can cause infertility.
Thank you. Thank you so much. Let's look at possible treatment, in male infertility. Yes.
Yes, possible treatment for infertility in men. Now, yes, before we go to treatment, I would really want people to emphasize prevention. Yeah, it's very important for people to take care of their health by preventing these things. For example, avoiding things like excessive alcohol, smoking, doing saunas all the time, and use of recreational drugs. If you can avoid those, then you'll be left with a few things to deal with.
That can easily be.
Yeah. Then so in terms of treating those who end up in this problem, again, the treatments depend on one, identifying the cause. Yes, what is causing the problem. For example, if the problem is caused by, for example, use of those things, you tell them, please stop them. And in most cases, they will regain if they have not been using them for long. Yeah. But for others, the problem may be hormones. Yeah, others, without their notice, their hormones, the male hormones, either too low or too high, and then you find the production of the sperm is affected. So in that case, we're able to remanipulate the hormones into the normal ranges, so this needs medications. And the body will be able to function normally and produce the sperms.
Okay.
But there are some few cases which need some other forms of assistance. For example, that's where you need to do assisted fertilization. So the sperms are too few or they are too weak, they are not able to fertilize the eggs. So we have to get the sperms and we get the eggs out and fertilize them out.
Okay.
And then put in the woman's womb. Or if the sperms are too few, we may need to do insemination. That's the case where we'll have to do insemination. Yeah, so there are treatments available.
Are there some tablets someone can swallow?
Yeah, so if the cause is already identified, there are a number of tablets which are available.
Okay.
Yeah, so there are a number of tablets which are available. Sometimes you take them alone, others you take them in combination, depending on the result of the evaluation.
Okay.
Because sometimes the issues, you have to balance the hormones, but also you have to do other things as well. So, but the treatments are available, just to tell people.
Okay.
Yes.
Thank you, Doctor.